Okay, the topic that we picked was teaching with OCD and Tourette's. So what is OCD? OCD is defined as an anxiety disorder characterized by recurrent obsessions or compulsions, or both, that cause significant distress. They're time-consuming, they interfere with normal daily functioning, and they're recognized by the individual affected as excessive or unreasonable. As stated in the name, it is most characterized by people who are obsessed with repeating thoughts, urges, or mental images that cause anxiety. And if anybody's heard of this show, it's called Monk. It's about a man who's a detective and he has OCD. That's where I was first introduced to OCD, actually. And he has so many urges where he has to touch every single lamppost. If he touches one twice, he has to completely start over and walk through those. It just takes up a lot of time. His food can never touch. He ordered mixed vegetables once at a restaurant and asked for the vegetables on all different plates. Just stuff like that. As he walks through the streets of California, he has to do everything the same every day. And they also obsessively wash their hands, wipe things off before touching them, and clean everything until it's spotless. And when I say spotless, I don't mean like you're having guests and your mom makes you clean your room kind of spotless. It's the kind of spotless where you clean it 18 times until it's perfect. There's not 1 ounce of dust anywhere. There are 4 factors that can lead to OCD being diagnosed. The first one would be a genetic predisposition. Although researchers have not completed their research, it has proven that parents, children, or siblings who have already received that diagnosis, your likelihood of being diagnosed with OCD is greatly increased. The second cause would be neurological causes. They're not completely understood, but differences in brain structure in the frontal cortex and subcortical structures can factor in an OCD diagnosis. The next factor would be environmental factors. Stress can be a huge trigger towards OCD. Research has shown time and time again that those who have been physically or sexually abused as a child have higher risk factors to developing OCD. The last one would be bacterial infections, and this is one that I thought was extremely interesting because apparently children who have had a streptococcal infection are also at a higher risk of developing OCD too. There are many different signs and symptoms, and those symptoms actually have their own symptoms. For example, the first one would be obsessions, and there are many different types of obsessions that one may have after being diagnosed with OCD and that they struggle with. The first one would be fear of germs or contamination, as I said before. If they shake your hand, they have to wash their hand or hand sanitize. They wipe everything off before touching it. If they touch anything abnormal, wash their hands, taking multiple showers a day. They also have unwanted, forbidden, or taboo thoughts involving sex, religion, or harm. They also have aggressive thoughts towards themselves or others. The last obsession would be having everything in perfect and symmetrical order, everything lined up in colors of the rainbow, all that kind of stuff. Also, the second symptom is compulsion, and the symptoms for compulsion is, as I said, excessive cleaning and or hand washing, ordering everything and arranging everything in a particular and precise way, repeatedly checking on things, such as repeatedly checking to see if your alarm clock is on in the morning for the right time, checking to make sure you turned off the oven, or to see if the door is locked. You have to do it 16 or 17 times, or 3 to 4 times. There's always a specific number that they have that they will do. Also, compulsive counting is the other one, where they count everything, or they repeat things 3 times or 4 times every word they say. Another one would be struggling with self-control. They can't control their thoughts or behaviors, and even when they know that they're excessive, for them, they know it, but they can't control it. And the obsessing over these thoughts and everything, they can take up to over an hour total in a day, every day, obsessing over just different things. When they do perform these rituals and tests, they actually don't even get pleasure. It's just this complete sense of relief. This causes significant problems in their daily life due to these thoughts or behaviors. The historical diagnosis and treatment of OCD, it wasn't actually officially coined until the 20th century as OCD, but there are traces back to the 14th century. Throughout the 14th through 19th century, OCD was thought to be a religious problem rather than medical. one is scrupulosity, which in our modern day language means to obsess over one's sins and compulsively do acts of religious devotion. And when I read that, it really reminded me of the book, The Scarlet Letter, the one man who would beat himself because he was like obsessing over that one sin that he had. For those who were not obsessed, who they were like, no, it has nothing to do with religion or anything, people told them that they were just being melancholy and needed to move on with their lives. It wasn't until the end of the 19th century and the beginning of the 20th century when it was become known to see as a disease or a disorder. And although they did not have the resources at the time, those who were ridden with impulses and obsessions were finally receiving support and doctors' attempt to be helpful. The name OCD was changed several times over the next couple of centuries, but it wasn't until the 20th century when Freud's term Zwang's neurose, meaning irresistible thoughts, was changed to obsessive in the United Kingdom and compulsive in the US, and because researchers from both countries agreed that both of them went together, OCD became known as the name, and it became known as obsessive compulsive disorder in the middle of the 20th century. And now I'm going to show a little video about what it looks like for those who have OCD.
It can be obsessive thoughts and repetitive behaviors. Children with obsessive compulsive disorder can be diagnosed as young as 6 years old.
OCD is a disorder that is comprised of obsessions and compulsions. It's probably about 2% of the population in children, and that may be an underestimate because people don't always like to talk about it.
Child psychiatrist Dr. Denise Duchik says the obsessions can interfere with the child's concentration.
When it starts interfering with their ability to engage in their usual activities, school, going out to play, engaging in family activities, because they have to do their compulsive behaviors and repetitive rituals, then that's probably the time to bring them in.
OCD is a hereditary disorder that can often lead to other problems like ADHD, Tourette's, even depression.
Some of the compulsive behaviors might be the need for symmetry, having things just lined up just so, or in an even fashion.
The disorder can be lifelong, but with treatment, some children can outgrow it.
Yes, it can be treated quite well. We have psychotherapies that will be helpful. Sometimes the cognitive behavioral psychotherapy will help.
Doctors may also recommend medication. If a child starts a treatment, it's important the treatment is consistent at home and at school. For Lee Health, I'm Lindsay Fry.
Okay, and now David is going to come and talk about diagnosis.
Okay, so let's see if anyone in here has OCD. Can anyone point out what's wrong with this picture? What stands out to you as what might be wrong with this picture? Yes?
There's a pencil tip that is not completely even.
Wow, okay.
Blue one.
That's one thing wrong with it, that's true. Okay. Can anyone else find anything wrong with this picture? Ken?
The tops don't match the pencils that are in the box.
That's right, yeah, the actual colors on the box, they don't match the order that the actual pencils are in. So so that's one thing that might drive, that might have someone with OCD. They might notice that. Here, can you point out what's wrong with this? That's true. There's a tile slightly askew in here, it's rotated 90 degrees. I refuse to believe that anyone is morally reprehensible enough to do that on purpose. So, and then here, can we point out what's wrong with this?
Psychopath is taking pills.
That's true.
Takes it.
So there's one left here, and so they took it from this one. So these are just little things that bother pretty much everybody, but only a little bit. But someone with OCD, these might be more serious. or they might trigger something in them. So let's get to the characteristics of OCD. What are the main things in OCD that you can notice? So there are two things we need to talk about. There's obsessions and compulsions. And with the obsessions, there's usually a theme to them. They're not random. You get them based on a particular kind of running theme that runs throughout. So just some examples, hating uncertainty. If there's something they can't be 100% certain about, it'll absolutely drive them up the wall. They can't stand not being 100% certain about something. So that could be one example of a theme. Additionally, there could be needing for things to be orderly. So if there's, say, like that picture we saw earlier with the pencils in the box, they would have to take all those out and arrange them, or it could be really anything. Like we were talking about earlier, the mixed vegetables. You could put each one in its own plate. That could be an example. Additionally, one thing could be aggressive thoughts of harming other people or yourself. Additionally, and even worse, it could be unwanted thoughts of aggression. They could be sexual thoughts, or they could relate to something religious in nature. So these are all just themes that could potentially be that could be attached to the obsessions. The compulsions are also themed. Some themes would be following a planned routine. So before they go to bed, they have to do exactly the same routine, just every night. They have to do it exactly the same way. If they mess up, they have to restart and they have to try again. This can take minutes or hours, just depending on how complex the order is. Additionally, you have to keep checking. So did I really lock the door? Okay, I have to check, and then check 3 or 4 times, or just dozens of times. It just depends. Additionally, orderliness, like we were talking about earlier. So the compulsions, and to make sure everything is precisely ordered. So now let's talk about the prevalence of OCD. How likely are we to meet someone with OCD, and how likely is it to be one of our students in the future? So only about 1 to 3% of children have OCD. As we heard earlier, this might be a little lower, but this is as best we know for sure right now, that it's about 1 to 3%. So not a huge amount of children, but a good amount. About 20% of children with OCD tend to show it before the age of 10. So 1 out of every 5. So if you're in LED, you're more likely to see it around then. So finally, boys are about 1.5 times as likely to have OCD than girls are. Now let's get on to how you can diagnose OCD. It's not an exact science per se, but there are certain telltale signs. So let's break down what OCD means, and that'll help us understand how to diagnose it. This is something I like to do. When I don't understand a word, I like to break it down and see if I can figure it out from that. So OCD, obsessive compulsive disorder. There are 2 main factors in OCD that you look for: the obsessions and the compulsions, obsessive compulsive. So for the obsessions, obsessions are what the OCD revolves around. These are what the person notices. But the compulsive behaviors are what the person does in regard to the obsessions. So, for instance, you might have an obsession about orderliness. That could be a theme for your obsession. And so your compulsion would be to order them in a particular way. Additionally, so you have to show obsessions and compulsions, and most importantly, compulsions need to take up a significant amount of time and interfere considerably with your daily activities. If it's just a couple seconds, then it's not really taking up time. Can it really be considered a compulsion? And if it's not a compulsion, then you have an obsession, so you probably don't have OCD. And now Trisha is going to tell us about the teaching strategies.
So this is where the teacher must know the student with OCD. In the classroom, the decorations can be very overstimulating, and the classroom should be organized and neat. So for seating arrangements, you need to know where the student can learn best. Can they sit in the front, or do they need to sit away from the noisy hallways? Or do they need to sit in the back to hide their OCD, like if he rocks back and forth, or just plays with his hands, something like that. So again, we constantly need to be asking ourselves, where can we put the student to be most successful? For the second one, extended time for tests and papers. That child with OCD is gonna find the perfect way to say something, and timed tests are extremely anxiety provoking for these students with OCD, because they're constantly looking at the clock or they're just easily distracted. So constantly as teachers, we need to encourage them to do the easy questions first and then go on to the hard ones to build their confidence up. Then third, break homeworks into chunks. So whether it's math or reading homework, you can make it bigger on the paper so it makes it look like it's less homework and they can focus on one question at a time or something like that. And then fourth, plan a safe place. So a child with OCD, when they get overstimulated, they need to cool down, or they feel scared or just frustrated. And so for that child to know that when they are overstimulated, they can go into a safe place will be super comforting for them. And that can be a place in their classroom or just the hallway, just somewhere where they can relax and just be themselves. And then more, provide a textbook or books orally. A student with OCD, they could obsess about the word count, whether it's being odd or it's just there's too many pages on a book or something like that. It could really frustrate them. A student with a germ obsession. Now this is usually what we think of with OCD, but this is like it's okay for that student to have a hand sanitizer right there at their desk, and they can use it, I guess, as many times as they want. I kind of blanked on that part. Okay. Next, a student with OCD should use mechanical pencils because, you know, the other pencils, if it's not perfectly sharpened or something, they'll obsess over that. And again, this is just where we need to know our students, because if pencils really become the issue, then they could just answer orally or just allow the students to use the computer and stuff like that. So I think we're going to Tourette's.
Yep. Okay, before we talk about what Tourette's is, I'm going to give you a quick history of Tourette's. It was first formally recognized as a disorder in 1825. It was actually kind of funny that this was recognized because there was a woman who all of a sudden started swearing, saying inappropriate stuff, and while it was a woman, she probably, in the 1800s, she probably normally would have been like just shunned and been like, oh, she's crazy, she's a horrible person. But people knew her. She was well known as a lady of refinement and great taste. She had intelligence, great manners, and had a good educational background. So people were like, okay, yes, she obviously does have a problem, because she would normally not have been like that at all. It was recognized by Dr. Jean Gaspard, and he diagnosed her. It was first given the name Tourette's in 1885 in honor of Georges de la Tourette, who defined the disorder. He was a French neurologist that studied psychotherapy, hypnosis, and hysteria, and he found a way to define an illness that was distant from chorea and hysteria, and that came to be known as Tourette's. It was first thought to be psychological until the 1970s, when it was thought to be neurological. It's not completely known what it is, if it's psychological or neurological, but most people call it a psychological disorder. And in more recent years, in fact, it's also thought to have maybe a biological predisposition as well, but still a lot of scientists will call it a neurological disorder. So now we're going to see what actually is Tourette's. And as I said, it's known to be a neurological disorder characterized by or stereotyped by repetitive, involuntary movements and vocalizations called tics. These tics are kind of like just like a jerk of the head, or it can be even more severe. Tics are usually first noticed in childhood between the ages of 3 and 9, and those who have Tourette's endure, usually it's worse during the early teens. Although they never go away, the severity and frequency of these tics usually lessen after a couple of years after peaking. There are different kinds of tics, and the symptoms include facial grimacing, sniffing or grunting, and then more complex tics have patterns are usually 2 different tics at once. So the the most common type would be just like grimacing your face or like this. The more complex symptom would be where you yell and you tick all at once, or in a pattern where it'll be yell, tick, or tick, yell, yell. The most complex type is called coprolalia, and it's only seen in 10 to 15% of people with Tourette's. And this type of Tourette's includes involuntary self-harm, swearing, and inappropriate comments to other people. These tics are all fairly prevalent and occur frequently throughout the day. However, they get worse if someone gets excited or anxious and they calm down, and once they calm down, the tics are a little bit better. Tics are usually involuntary, but there are a few people who are known to be able to control them. However, it's very hard on them, and as time goes, they feel like they're just like not able to release any tension. It gets built up, and then they feel suppressed, and it just comes out, and it's usually way worse if they keep them in. The cause of Tourette syndrome is unknown, but there are many different ideas about what behind the real cause of Tourette syndrome is. Currently, research points to abnormalities in different brain regions with circuits throughout the brain that cut off communication with the nerve cells. It's an extremely complex disorder, and determining the cause is especially hard to know for certain. So the diagnosis for Tourette's, the tics, there are different diagnoses that they use. For one, if people have tics for 1 year, then they can go to a doctor and they'll test them, and they can do like blood tests or MRIs to rule out other conditions that may be the cause of tics other than Tourette's. Others have it just is extremely apparent that they have it, and they don't even go to get a diagnosis at all. And then sometimes people have to go to the doctor right away, and they get diagnosed right away, and they get help for that. The neuroleptics are the type of medication that would help with those tics that interfere with function, but because Tourette syndrome does not cause an impairment, medication is not always necessary. In the case of those tics which interfere with function, neuroleptics are the ones that will help suppress them, but there's unfortunately not one single drug that can help all people with Tourette syndrome. Different people have different needs for their different kind of Tourette's. For those who are trying to get off the neuroleptics, eventually they just really need to remember to take it slowly, because if they go off it suddenly, the tics are more likely to get even worse than they were at the beginning, and also it could cause withdrawal dyskinesis. Alright, David?
Alright, so let's go over some of the characteristics of Tourette's. What are the more common things you can expect with people who happen to have the Tourette syndrome? So as we learned earlier, they have tics, and these are going to be either motor or vocal. So they're going to involve either your movement, which is motor, or they're going to involve something that you say or sound, which is the vocal. So some examples would be having to rock your head back, or suddenly barking or yelling. So these are just some examples. Something that may come as a surprise, because it's so frequently depicted with Tourette's, is that swearing is actually quite rare as a tic. It's pretty frequently associated with Tourette's in movies and TV shows, but it's actually pretty rare. Only about 1 in 10 people who have Tourette's actually have swearing as a tic. Tourette syndrome is usually going to appear between the ages of 5 and 9. So pretty young, but it'll be around the elementary age. Additionally, if you do have Tourette's, it's going to come before you hit 18. If it's after 18, you either have a very rare form, hitherto unknown, or you don't have Tourette's. Additionally, the tics are going to change over time in their location and how frequently they come about, what type of tics you have, how complex they are, and how severe they are. It just changes over time, and just however it works. So now that we know what Tourette's looks like, let's go about how prevalent it is. How likely are we to encounter it as teachers or in the wider world? So only about 0.5% of children actually have Tourette's. So this is not a huge number, but it is important, and if you make a career of teaching, you're probably going to run into them eventually. Additionally, boys are about 3 to 5 times more likely to have Tourette's than girls. So if you do have a child with Tourette's in your classroom, odds are it's going to be a boy. Additionally, over 1/3 of people who have Tourette's also have another condition. In this case, it's OCD. Overall, 86% of people with Tourette's syndrome have an additional condition. So not just OCD, but overall 86% have another condition. So 1/3 of them will have OCD, but in some cases 63% have ADHD, 47% have learning disabilities, and 12% have intellectual disabilities. So if a student that you have has Tourette's, odds are they're going to have at least one other condition, including Tourette's or OCD or ADHD or some sort of learning disability. So be prepared to have to do a lot of multivariate analysis on what you need to do to help your child. Finally, let's talk about how we can diagnose Tourette's. How can we tell if someone really has Tourette's? There's no perfect way to diagnose it. There's no checklist where you go, check, okay, you have Tourette's. You can't say for certain, but you can be medically certain that a person has Tourette's. Some things that they look for are a history of signs and symptoms. So they'll see, do you have tics? Do they come in the right frequency and the order? Did they develop before the age of 18? Did it develop between the ages of 5 and 9? So this is one thing they're going to look for, is what's your history of showing these signs and symptoms. However, there's a danger in diagnosing Tourette's because its characteristics, along with the fact that it usually comes along with a lot of other conditions, can cause it to be misdiagnosed fairly frequently for other symptoms, for other conditions, because it comes with so much baggage. So there's a lot of danger in actually trying to diagnose Tourette's. And now we're just going to go with Trisha and learn some teaching strategies for Tourette's.
So Tourette's can affect a child's experience at school. So although they are all in the same grade and learning the same thing, they are in a completely different school experience. Some may have difficulty reading or writing, or others will have difficulty focusing because they're trying to hide their tics. Most children with Tourette's, they'll have the same intelligence range as other children, but the tics can cause difficulty to keep attention or just other learning difficulties. Yeah. So I'm gonna play this video real quick.
Okay.
Hello, I'm Elizabeth Vargas, and welcome to 2020 in Touch. It was hard when any of us started our first day at a new school. We see it in our kids. But what would that first day be like if your child had Tourette's syndrome, with a non-stop volley of physical and verbal tics? Jay Shabler takes us through a day like no other.
As for Devin, she's begun touching, rattling, and polishing the door knobs. This oddity is one of those compulsions common to many Tourette's patients and triggered by this morning's stress.
I want to be homeschooled until college. For 3 years, we had such a great time, and now we're ready for our next adventure. I'm not ready. We'll be over. Push the back.
Ready or not, Devin's going to school, escorted by her mom and dad.
Alright. You have an absolutely fabulous day. I love you so much.
During these very first hours, she's agreed to give a brief presentation on Tourette's to her classmates.
I have a chemical imbalance in my brain. It causes me to do things called tics. I'll grimace and blur my eyes. Don't think I'm being rude, it's just one of my tics and I really can't help it.
Unexpectedly, it also becomes a memorable show and tell.
When somebody has a tic and they can't really hold it, they can hold it in a little bit, like if you kind of hold on a sneeze, or if you have an itch on the bottom of your foot and you can kind of wait a little bit, but you're thinking the whole time, oh my goodness, I've got to scratch my foot. Well, if Devin tries to hold her tics in, it's the same thing. It's all she can think about. I've heard of it, but I've never seen something like it before. You don't know if people are talking behind your back or laughing at you? Yeah. It's hard to make friends when people are already making fun of you.
At recess, Devin seems to make a few new friends.
What's your favorite animal? A dog. So what grade are you at?
By the end of the day, her mood darkens.
Horrible. I hate it here. Do I have to go back?
Sweetie, yes you do. Okay?
Why? Can't Grandma homeschool me?
No.
But I hate it here. It's the worst place ever. Oh boy.
Things only get worse back at home.
Daddy, I hate it there.
When she hangs up on her dad, Maura reaches the end of her patience.
Did you hang up on your father? Yes or no?
If you can come home, that'd be good. I know not now, but don't stay late.
Leaving Devin to play out her tantrum, Maura heads to pick up one of her other daughters at soccer practice and to psychologically regroup.
I hate to say it, but this is typical of Devin. Emotionally, she's all over the place. I don't know if it's, a symptom of Tourette. I don't know if it's just an 11-year-old attitude.
That's a common question. Is it Tourette's or is it bad behavior?
So that video is just giving us an insight of what it's like being at school for the student and also the teacher with tics or Tourette's. So now, what to do as a teacher. First, ignore the tic. I know it sounds really bad, but it can give this person with Tourette's tons of anxiety, just everybody staring at them because they can't help the problem. Allow transition between activities. A student with Tourette's will have difficulty transitioning from one activity to another, especially with unexpected, change of senses in a sense, like if it's too loud or too bright, or it smells funny, or just people are touching her, it may just cause more frustration and anxiety. And without that transition, there for sure will be stress and most likely anger. And then allow the student with Tourette's to leave the classroom 2 to 3 minutes earlier. Now this has to do more with the transitioning, and this will just help with the overstimulation and the anxiety and the stress and the anger that could be there. And then help the person with Tourette's develop self-help techniques. Some of these techniques could be breathing techniques, just taking deep breaths and then exhaling, or engage in an activity that requires concentration. Something like, say the alphabet backwards, or go play a sport, or something like go and draw, or something that just takes herself off the Tourette's and focusing all of that energy somewhere else. Use a fiddle toy, like what are they called? Fidget spinners. Those will be great. Allow space for an individual with hitting or kicking tic. So that means maybe he has to sit in the back of the classroom because he can't really control his body. And then just remember that medications for Tourette syndrome have side effects which may affect performance and behavior at school. So it is okay to ask the school nurse or the parent about typical side effects that may impact learning and use them as a resource. So everyone is on the same team to lead that child with Tourette's to success. So this is just one area we as teachers can figure out what can we do to allow this child to succeed further than education. So then teaching modifications both for OCD and Tourette's. For attentive and concentration. So there is no cookie cutter approach for all of this stuff is just one size does not fit all. A person with OCD could be totally different than your other student with OCD. And so for this, yeah, just help them just stay concentrated while that may be just handing them the notes that you're going to talk about, or just other stuff like that, and help to hinder confusion and frustration. OCD or Tourette's, they will not function well in an unstructured, disorganized, overstimulated classroom. So it needs to be very, just one color, everything is organized and neat, and nothing can really cause them to be distracted. To manage time, this just allow breaks, like I said, in just chunks of homework at a time, just help them process what is happening, and too much information will cause anxiety or frustration. And then for behavior modification techniques. So this is where psychotherapy that uses basic learning techniques to modify maladaptive behavior patterns by substituting new responses to given stimuli for undesirable ones. So basically that is just how I was saying earlier, engage them in an activity that requires concentration. So when they are being obsessive, just redirect their thoughts somewhere else, whether that is drawing or saying the alphabet backwards or going for a run, something that they can just do to just help themselves in the long run. So that is all that we have. So if you guys have any questions, just email us and we will answer them.